Good afternoon, everyone, and welcome to Tools You Need to Provide Care to Older Adults During COVID-19. Today's webinar is about new ways of providing care during COVID-19 so that you can better support long-term care homes within your capacity as an educator. On the right-hand side of your screen in the handouts box, you can find a PDF of the slides and a handout on mindfulness exercises. My name is Stacey Guy, and I am a knowledge broker with the Ontario Centres for Learning, Research and Innovation in Long-Term Care, or CLRI, hosted at Baycrest Health Sciences. This webinar series is brought to you by the Ontario CLRI in an effort to support educators within long-term care. Just a quick reminder that this webinar is being recorded and it will be posted on our website within the next week. I'd now like to pass this over to Caitlin Vio-Alick, Lisa Sokolov, and Raquel Meyer, who will be leading this webinar. Caitlin is affiliated with Behavioural Supports Ontario, Lisa with Baycrest Health Sciences, and Raquel with Ontario CLRI at Baycrest. So over to you.
Thank you, Stacey. Welcome, everyone. Thank you for making time on this beautiful day to join us for this webinar. We're really pleased to share with you a selection of curated resources that you may find helpful with your teams during COVID. So as Stacey mentioned, Caitlin, Lisa, and I are really pleased to be here, and you will have access to our contact information through the webinar slide here that's also in our PowerPoint PDF. Quickly, we would like to acknowledge the support of the Government of Ontario in our work and simply to say that the views expressed herein do not necessarily reflect the views of the province. Okay, so today we're really pleased to be able to bring to you some evidence-informed resources and supports that you can incorporate into your team's work around new ways of providing care during COVID. And we'd love for you to consider how these can be used in your practice to support both new team members and your current team. So we'd like to begin with a little bit of a poll to get the temperature of the group. So please tell us, we're going to go to Mentimeter, which I've clicked on. Now that we are kind of at the tail end of wave one, please tell us, what are your team members needing with respect to providing care? What kind of concerns are they bringing forward? So go to menti.com. and then enter the code 898093, and then you can type in your response. This will help us shape a little bit of the presentation to sort of address some of the concerns that your team members are bringing forward. So please do tell us. Giving people a little time to get into Menti and type in your response. If you're having, here we go. That's great. So how do we manage these new outbreaks? Visitation and visits are top of mind. And fatigue is coming into play. How do we sustain this? Still the IPAC concerns, infection control, eh? All right. Safety for residents and for themselves, yes. And education is an ongoing concern. Excellent. Thank you for sharing that. So can we go back, Selma, to the PowerPoint? There we go. Excellent. All right, we have a second poll. So now that you've told us what your team members are bringing forward, as educators or in your leadership role, I know we have some DOCs on the line, what do you perceive the greatest learning needs to be for your teams? So let's go to Menti again. We're going to do a second poll. Here we go. So as educators and as leaders, what do you perceive to be the greatest learning needs of your team? I like that one, overcoming fears. It's very much the reason for masks, prevention. Mental health, self-care, infection control, supporting each other. Love it. Staying healthy. Yes, these are great. Thank you. I think we are going to be addressing some of this over the course of our webinar today. These are really helpful to us. Thank you. I keep hearing from the people I've been speaking to about this need to, kind of build that persistence in IPAC and that attention to self-care. Those are really important. Okay, thank you. Let's go back to our slides. And we'll dig in, and I think you will find that there are some tools here that do relate to the concerns that have been raised. And so what we've done is we've tried to guide you through the resources in a particular way. So first, a set of orientation and training resources that you can specifically use with new team members, whether those are new hires, redeployed staff, or students and volunteers, whoever those might be, some entry-level type orientation and training. And then for all team members, we're offering you some resources grouped around clinical guidance, social connectedness, and team wellness. Okay, so with respect to onboarding aides, volunteers, students, those very kind of entry-level roles, you will find that there are orientation resources for these types of support roles through the CLRI website. And as you can see here, we've listed out the topics that are covered, so that basic knowledge around what is long-term care, COVID, infection control, the Bill of Rights, and then communication and person-centered care around communicating with teams, families, with residents, communication at end of life, and those basics around person-centered language and how to get to know a resident. Some of those new people coming into long-term care may need some of those tools to help them. Also, how one can offer support in long-term care, whether it's with somebody living with dementia, if it's around mobility or recreation activities, and self-care. And the personal basics around some of the oral care, bathing, dressing, and mealtime support. So this is a great place. I know that some homes have readily taken the resources and added them to their own learning management systems, if that's how they are bringing people in. And so we encourage you to make use of these freely as you see fit. All right, there is another provincial resource available to us through covidcarelearning.ca, and this was it's a very basic learning management system. It's available to healthcare workers and students in the province. It's free, and it was designed during the early days of COVID to really help staff who were being redeployed to care for COVID patients in critical care units. It expanded to acute care, and then as COVID unfolded and we realized that long-term care was a key place that we needed to devote our attention to, they invited the Ontario CLRI and Baycrest to build out the long-term care section of covidcarelearning.ca. And so this is available, so if you have any hospital staff being redeployed to you, this is a great place for them to get onboarding about all aspects of the role that they'll be coming into, not just COVID care, because we know that they're coming in to shore up staffing in long-term care, and it's also open to any new hires or others coming into long-term care. There is an access code, and it's not to be posted publicly, but I will tell you that it is capital T, small r, CC, 2020, exclamation mark. And that's how you get in to register. As you can see, there's a wealth of information under a variety of tiles here. We'll click down. Oops. And here are the roles that we have content for, from environmental services and aides to meal assistance, to our caregivers, in terms of PSW, nurses and physicians and NPs. And so some of the content from the CLRI website is repeated here, but it is definitely expanded and more advanced than the content on the CLRI website. This was for people who were coming in, a physio coming in to work as a PSW would need to know a number of things about the PSW role in order to provide care. Once you go in, for example, this is a screenshot of under personal support worker, just the top of it. There are quite a few resources available, and so within the limitations of the system, we were only able to indicate where you see the circle and the arrow, whether something was a priority in this way. So not to be overwhelmed when people go into this site, which has a lot of information, but if they look for the priority tag against the title of each resource, they'll have a sense of whether that's something they should be doing sooner rather than later. Great, there's about 7,000 people that are in covidcarelearning.ca. And with that, I'm just going to pass it over now to Caitlin to talk about some of the clinical guidance resources we have.
Perfect. Thanks so much, Raquel. So certainly some of the other areas that we've been receiving a number of requests for support around are in the topic area of care planning, social connectedness, as well as therapeutic engagement. So these next few slides will really dive into those pieces. So, and one of the key resources that we've really wanted to start off with in terms of what to highlight is the ethical guidance document developed by the Dementia Isolation Toolkit team, which is led by Dr. Andrea Iaboni. And in this document, rationale and ethical guidance is provided alongside a number of helpful tools. And on this next slide, a number of these tools are pictured. So we'll start here on the left. So included in this larger toolkit is an infection control and isolation care plan template, which you can see again here on the left, as well as a isolation decision tool, which is displayed in the middle. These tools can be really helpful for developing a fulsome isolation care plan for a particular resident if that is part of your role, but it can also be used more informally when huddling with various teams who might be needing to think about strategies to support residents to remain isolated. So both of these tools can really be used in order to inform direct support, but also for educators and directors of care and others that are in more leadership roles. We also, in thinking back at some of the responses from that Mentimeter that we had posted, I saw a few indicated that planning for new outbreaks is certainly an area of priority concern. So certainly both of these documents, these templates, can be used to assist in thinking about what might be some of those common or home-wide or neighborhood-wide approaches to consider. Also embedded within that same toolkit is the tip sheet that you're seeing here on the right, and that's the non-pharmacological approaches to support people living with dementia to maintain isolation precautions. And again, in that Mentimeter, we saw a couple of responses specifically pertaining to supporting residents living with dementia. So this document provides quite a number of non-pharmacological strategies and some practical tools that you can consider using, and they're all built using the pieces approach, which of course is very familiar to many of you. So aside from this first toolkit, which is available on their website, the group is actively working on additional resources, specifically to support residents living with dementia during the pandemic. So definitely please stay tuned by visiting our COVID-19 webpage on Brain Exchange. We'll have the link later on in this slide deck. And you can also follow our provincial office, Dr. Iaboni, directly, or UHN on Twitter, as there's regular updates and tip sheets being posted there as well. I'm just trying to navigate to the next slide, and it doesn't seem to be letting me do so. Oh, perfect, thank you. Aside from the tools to provide general guidance and tools for care planning in general during the pandemic, one of the other questions that we frequently received from our long-term care partners and our psychogeriatric resource consultants and others that are providing education during the pandemic has been for strategies for conducting nasal swabs. So hopefully both one or both of these tip sheets that you're seeing here displayed on the right are familiar to many of you, but so just wanted to emphasize quickly for those of you that haven't seen these yet, that the RGP of Toronto as well as the Mississauga-Halton BSO team released really quick tip sheets to assist in conducting nasal swabs for individuals that are living with dementia. So both of these documents contain some general key considerations, things like having a person who is familiar with the resident either conduct or assist the swab, being mindful of what time of day, if it's at all possible to offer flexibility, and of course being mindful of approach and communication. And so, of course, as we move into various phases and stages of the pandemic across the province, these tip sheets may be helpful to revisit with your long-term care teams and those that are leading those swabbing initiatives as we move into the fall. On the next slide, perfect. We'll move on from clinical guidance and really dive in to some recommendations and tools and resources to support social connectedness as well as therapeutic engagement. Of course, this topic is very top of mind for many. We all know the importance of social engagement and the negative impact of social isolation for residents living in long-term care. And many organizations have developed resources and toolkits and other documents to help support social connectedness, and the need to be really quite creative during these uncertain times. So to assist in kind of organizing all of these various tools, I'll start by first highlighting the initiative that you're seeing in the center of this slide, which is led by Dr. Jennifer Bethel, whereby we've been collaborating in search of evidence-based strategies to support social connectedness in long-term care. And this work started prior to the pandemic, and if we go to the next slide, you'll see that within the scope of this work, 12 different domains relating to social connectedness were highlighted, including finding opportunities for creative expression, laughing together, gardening. You can see all 12 of them displayed here. And this work is available to download as a full infographic if you visit the web link listed just on here on this slide. And you can also request free copies of poster versions of the infographic, which you can display in your long-term care homes to help promote some of that creative thinking around social connectedness. So we had started on this work prior to the pandemic, and of course, and are now really diving into how we can equip long-term care teams to promote these 12 domains within the context of COVID-19. And so on the next couple of slides, we have a sneak peek of 4 of the domains to share with you, just to provide, again, some additional tools and resources to share with your team members to assist in planning. So we'll start with the use of technology to communicate. Certainly this is a significant area of interest since the beginning of the pandemic. So things like virtual visits and virtual programming being hosted by community organizations. We've heard of we've heard from a number of long-term care homes that have initiated email programs whereby families can send emails, videos, photos to a generic email address, and then have those products shared with specific residents and recording responses back. All of these things really make excellent use of technology. And so there are a number of toolkits from the Ontario Association of Residents Councils, of course from our CLRI partners, that are available to assist in thinking about some additional tips and strategies for how to not only provide a variety of virtual options, but to really assist in how to organize them. Secondly, we'll jump to nonverbal communication. And under this area, we've heard from a number of long-term care homes that have initiated friendly letter projects, either involving community, people living outside of the community sending in friendly letters, or even exchanging letters between co-residents, and of course window visits, which have become a very common occurrence. And aside from facilitating family visits through windows, we've heard of a number of different innovations happening with window visits, whereby homes have created games, even simple games such as tic-tac-toe, on windows with washable markers. We've heard from homes that have held outdoor concerts, of course a little bit easier to facilitate in the summer months, through the windows, and even had visits from pets and other animals through the windows. So certainly the need for window visits is going to continue to fluctuate based on the various stages of the pandemic. As Raquel emphasized, with us really entering into the end of this first wave, and so the ability to host visits outside is certainly a possibility now for many homes, but this could certainly change in future months. And again, in thinking back to that Menti poll, there were many that emphasized a lot of questions coming from your long-term care team members about visitation. So hopefully these resources listed on the right column of this screen can be of assistance there. Of course, communication in general continues to pose a struggle during the pandemic. So we also included a couple of resources here, one being the person behind the mask, which is a quick tip sheet to assist in facilitating communication with residents while wearing PPE. So if you haven't seen that, definitely encourage you to have a look at that. So the next two domains pertain to creative expression, and of course this is an area of significant importance, especially as we have new residents moving into long-term care needing to undergo those 14-day isolation periods. So we've heard from many long-term care homes that they've developed individual activity kits, which include a number of products and resources that pertain to the resident's personhood, really things to keep residents busy and meaningfully engaged during that isolation period. Outside of those first 14 days, we've also received a number of creative ideas, such as making art for windows, hallway music hours, creation of art on tablets, and there are a number of resources on this topic here listed on in that right column that can assist in brainstorming what might be a viable option for your home. And lastly, of course, keeping residents moving during periods of time where they might not be able to leave their rooms is an important domain. So really just wanted to highlight a couple of resources specifically for older adults at no cost that may be helpful to use in your homes. So as I mentioned, this is really just a sneak peek of some of the ideas that we've adapted for the COVID-19 context based on these 12 domains, and we'll have additional resources available in the coming months, additional tools and associated larger toolkits. So I'm mindful that within those slides there were quite a number of hyperlinks leading to all sorts of different partner organizations across the province and even beyond. So just wanted to highlight that all of these resources are available within a couple of larger repositories. So on the left here, we have the Brain Exchange and Behavioral Supports Ontario COVID-19 webpage. So we continue to keep that updated, and so all of these can be found there, and or also on the RGP of Toronto COVID-19 resources webpage. So we definitely invite you to have a peek at those. And so at this time, I'll turn things over to Lisa, who will dive in to team wellness.
Thank you, Caitlin, and thanks, Raquel, for starting us off. We're actually going to move into a new section now, and we are going to do another poll. So let's see if this, I've got this going. Okay, so it's another Menti, and just so you know, this Mentimeter poll has a different code. So you'll have to, if you've logged out already, log in again, or if you're logged in, enter a different code, and as soon as it comes up, we will tell you what that code is. A little bit of mystery is good in everybody's life. Okay, so the code is, again, it's menti.com. The code is 361953. And we've thrown a ton of resources at you, not purposely to overwhelm you, but we want to know, what do you do now to prevent feeling overwhelmed with regards to all of the COVID news and information? And I'm not just talking about the links and what we've given you. I'm talking about the news. I'm talking about websites. I'm talking about, you know, you go for a walk with your friend and you hear, they tell you everything that there is going on. So we'll just wait a few moments. Seeing some things around exercise, things around breathing, which is great. We're going to talk about that a little bit. Things about trying to manage. I think that probably means the misinformation, or maybe that is something that overwhelms you. Taking breaks, really important. Taking breaks from news, taking breaks from work, timing out from social media. You know, some of us could be on social media all day if we were able to. Living day by day, or taking things day by day. I used to say it is what it is. My new phrase now is it's going to be what it's going to be. So I'm just kind of getting used to it's going to change every day and every minute and accepting that. So kayak, oh, awesome. So some really specific things around exercise, running, kayaking, turning off media, taking time. That's great. Thank you. Playing with your grandkids. Absolutely. I love it. Nobody has put down baking. I thought that's the COVID thing. Everybody's learning how to make bread. So if anyone's been baking bread, you can put that in as well. Thank you. Someone put in baking. I can tell you, I have baked so many batches of cookies. It's a little crazy. Okay, so we can close this now. Salma, will you do that for me, please? Thank you. Okay. We're going to break this section into supporting your team and supporting yourself and caring for yourself. And the reason we want to focus also on supporting your team is that we know who is here as attending. You are leaders in your organizations, you're educators. People look to you for advice and knowledge. And part of that is making sure that they are well too, and that the team is working together, and that a team is healthy such that when one person is not doing well, because we all have those days, right? When one person's not doing well, that other people are available to support them. So I'm just going to reference back to the CLRI website. And I can tell you, I do not work for the CLRI, but I have found these references on the website to be invaluable for myself and for my team. And if you go to the link that's on the top, and in the PDF, all of the links should be working. And you can see there's a lot of different activities and places where you can go specific to some activities to just, help you reduce some stress in your life, something specifically about mental health, things from social workers. So we just suggest you can take a look at that when you have time. Oops. Another really good free thing that we found is there's an app from CAMH, and it's available both on Android and iOS. So if you have an Apple device or if you have an Android, then you can go on, just search, go to the store, whichever one, Google Play or the App Store, Managing Your Stress and Anxiety, and you should see this purple logo with the CAMH, and it's free to install. And they go through it's for yourself personally. And what I love on it too is they have the perceived stress scale. This is also something you can do with your teams. If you're having a morning huddle, you could really go through that and look at some of the questions on the perceived stress scale to see if there's things that you as a team could work together. It's also a good thing for personal sort of self-reflection. Project Echo is something that I'm very involved with at Baycrest. And Project Echo is a way of using video conferencing to build capacity in primary care and healthcare providers. It's something we've been running for a couple of years, and maybe some of you have been participants in various of our care of the elderly echoes. We have some specifically focused on long-term care. And this spring, we were supposed to run one on long-term care, and we quickly pivoted and said, yes, we'll continue long-term care, but this really has to be focused on COVID because it started the first week of April. We had many topics. We had 12 weeks, but there's 3 in particular that I want to highlight to you, because if you go again to the LRI website, and the reason they're housed there is this was a collaborative partnership between our Project Echo, which actually is Baycrest, and Northeast Specialized Geriatric Services up in Sudbury. We are partners in Echo, and we collaborated with the CLRI team to run these 12 weekly workshops, Echo programs, and we recorded the didactic portion. And then after the didactic portion, there were discussions about cases, and people would bring challenging issues related to COVID and related to the specific topics. And Salma, who's working with us today here, actually listened to all of those and transcribed them to Q&A. So if you go to the website, you can look at any of the 12, but in particular, these 3 topics, watch the slides. They're about 20 minutes each, and then has some really great suggestions suggested by people like yourselves who are working in long-term care. Speaking of Echo, I don't have it up here, but CAMH is also running an Echo for people to join on their own, and it's about really your own personal coping and mental health during the time of COVID. And if anyone wants information about that, you can reach out to Stacy later, and we'll get that for you. A couple people mentioned breathing and just taking a break. And so I want to jump for a bit to mindfulness. And for some people, when you say the word mindfulness, you get this idea in your head of meditation, all that, and it doesn't have to be that. I'm not one of those people who does yoga and is really mindful and self-reflective and all that. I'll put that right out there. But I have found that at this time, doing some really, really short, calming, breathing, and grounding exercises is extremely helpful. And what I'm going to do actually is do one mindfulness exercise with you that takes 1 minute. And one of the handouts actually gives you examples of the one I'm going to do with you and another one. And these are things, again, you can do them with your teams at the beginning of a shift. You can do them right before you walk in the room of a resident who may be in distress and exhibiting some responsive behaviors. And you just need to breathe before you go in. And this sort of grounds you a little bit. So it's kind of hard to do this without seeing people, but if you just bear with me, we'll go through this together. So what I'm going to ask you to do is sit comfortably in your chair. Feel the soles of your feet on the ground. Make a fist with one of your hands and put that fist palm down on your thigh. You can close your eyes, or you can just softly gaze about 2 feet in front of you. Breathe in at a normal pace. You don't have to do anything special to breathe. Your body knows how to breathe. You're going to inhale, and then you're going to exhale. And each time you exhale, I'm going to ask you to allow one of your fingers to extend. So inhale, and then when you exhale, extend your thumb. Inhale, and when you exhale, extend your index finger. And I'm going to ask you to do that now and do it 5 times. Take 5 breaths in and 5 breaths out. And every time you breathe out, extend one of your fingers. Okay, now, since I can't see anybody, I don't know if you're done. So my apologies if I'm jumping in too soon. But again, do you see how quick that was? And normally when we would do this, we would debrief a little bit. I'd ask people, what was that like? What did you feel? So take a moment to yourself and just think about those questions. And if you felt absolutely nothing, that's totally fine. And if you felt a little relaxed, that's okay too. And if I put you to sleep, wake up. But just think about how it made you feel. And this is actually something I have to admit, I will do this frequently but you don't have to be sitting. If you're standing, you can just take that fist and hold it beside your leg. And sometimes you don't even have time to do 5 breaths, but you can do 3, or you can do 1, and just sort of ground yourself before you go, let's say, into a situation where you think emotions may be high. So that one is called Take 5, and that's in the handout. The other one's called Starfish, and there's a couple of resources. And I just want to shout out to our colleague, Kathy Smith, who is trained in mindfulness and is an expert, because I am not by any stretch. And she has put these together for us and given me permission to share them with you, and has given a couple of other references there as well. So let me go on. People, when we did that last question, many of you put some really great stress reduction activities up there, specific, like kayaking and running and baking. You were prompted for that one. But things to do to help you relieve your stress and breathe. And this is a resource that actually comes from Sunnybrook, I believe, where we first got it from. But really, it also mentions some of the things that came up in your responses, and that's about that work-life balance. So watching how much time you work. I don't know if any of you are working from home, but I find that on the days that I work from home, there are no boundaries because you turn your computer on in the day and you turn it off when you go to bed. And there's things that, you just address that perhaps you wouldn't if you were working every day in the long-term care home. Really important, again, is that you are the leaders. So you need to model the behavior, right? And talk about empathy and to your team. And if they come to you about workload issues, you are the ones, and some of your directors of care, I don't know if the educators would be so involved in this, but that you would be helping your team support each other in sharing workloads. Okay. I want to talk for a minute about media and social media. It's kind of, people have a love-hate relationship with these, and I loved that in the poll, some of you wrote down things like take a break from media. And if I could see you, I would ask you to raise your hands, ask you how many of you watch way too much CNN or MSNBC or Fox News or whatever you're watching, or CBC, CTV in April and May, and how many have cut down. And again, I will tell you that I was way overwhelmed by it and had to put limits on myself as to what I would watch, and knowing certain things would, I would be agitated by certain things. Okay, you can't do that because it's not healthy. And I apologize, this is the Sunnybrook reference here. This also goes around the stress, but they talk specifically about media and social media. Now, having said that, I also find that social media and the media are a fantastic way to get good information. It's figuring out, and someone wrote misinformation in the poll, it's figuring out what's true and what's not. And with social media, you can control that a bit depending on who you choose to follow. So I'm a big Twitter fan, and our Twitter handles are all on our first slide with our names. And I choose to follow people like Andrea Iaboni, who Caitlin mentioned, did the Dementia Isolation Toolkit, and her team, and Samar Sinha, and some other geriatric leaders and long-term care leaders. And I choose not to follow certain things. So I think that's some way you can limit what you are getting as far as what can sort of set you off and what can be really positive for you. I will say that all the things that Caitlin posted, all those diagrams and the visuals, I find those all on Twitter. And I find there's a lot of articles coming out now about COVID because things are being published really, really quickly, and I'm getting them all on Twitter. So that's just my personal opinion, but again, to balance that too much versus not enough, and how do you know how to get through that misinformation, is try to follow people who are reputable. And next slide, I am going to pass it back to Raquel now, who's going to wrap things up and then guide the questions.
Great. Thank you, Lisa, and thank you, Caitlin. I really appreciate all that you've given today. On this slide, we've just highlighted some key websites that you'll want to connect with. But also, please note, in the PDF, we made sure that the hyperlinks worked for all the PDF, for all the web links that were underlined. So you should be able to rapidly access what you saw today. These are kind of the resources we think, are solid and reliable. There's multiple ways to connect with us. We have our personal contact information up near the front of the slide deck. And one e-newsletter that you could subscribe to, of course, is our Ontario CLRI e-newsletter, which is very targeted and specifically to long-term care homes. So that's a great place to get resources and upcoming events and webinars such as these. All right, Stacey, I'm hoping we have time for opening up for questions in the chat or the Q&A, whichever way you prefer.
Thanks, Raquel. Yes, we do. So we're going to open it up to the audience for any questions that you may have for the presenters. If you could please type questions or comments in the chat box. In addition, during the question period, you will see a poll that'll pop up on your screen. We would like to offer more webinars based on your needs, so please indicate your topics of interest.
you feel there are gaps in the resources, or if you feel you're looking for specific tools, please let us know. We are continuing to develop tools in response to the COVID situation, and so understanding what you're looking for is very helpful to us. So please do share.
I would also add, if you have a favorite place where you're going for resources that we didn't present, then please let us know. Just put that in the chat box. And Raquel, maybe I'm incorrect, but maybe we should mention that some of the items on the CLRI websites are also available in French.
Yes, yes, we've made an effort to do that. So you will find most of those resources are available on the French version of our website. Oh, I see that the screen has done a quick poll. Please do tell us what future webinars would really compel you to attend. We know that learning in the home looks different now with COVID, and so there are potential ideas here that might appeal to you.
And once again, if you have any questions or you want to share a resource or you need anything clarified, please type into the chat box and we'll read out your question. And while we're waiting for any questions, just out of interest, we had the most response so far for our poll on how to engage and motivate learners. So thanks to everyone for responding to that poll.
I'm wondering if anybody joining today has had success in motivating their teams to continue using all the IPAC precautions and the masking and the gowning as needed. Has anyone found a successful way they could share? That would be very interesting. Always wanting to share best practices. So Stacey, I would invite anybody who has questions further down the road to reach out to us. Our emails are there and we'd be happy to support them, respond to any inquiries that they might have.
That's great. Thanks so much, Raquel. So I'd just like to take a moment to thank everyone for joining us this afternoon. Just a reminder that you will see the handouts, which includes a copy of the slides in the handout section. There will be a brief evaluation survey that will pop up when the webinar closes. The survey is anonymous. It'll take about 3 to 5 minutes. You can skip questions or the whole survey if you decide. And just wanted to say thank you again, everyone, for joining us and have a wonderful day.
Thank you for having us.
Thank you so much.
Bye.
Bye.